So far this semester, we've focused on health communication mainly from the perspective of health professionals to better serve the public. Now we're going to look at the ways that industry communicates with us, the consumer, and also how industry communicates with health professionals. Since this is a class on health communication, the term industry covers a lot of ground. We're talking about the food industry, of course, which includes restaurants and fast foods, and even commodities like the almond board or the dairy council. The healthcare industry includes hospitals and other healthcare settings, as well as insurance companies. The pharmaceutical industry, as well as the over-the-counter drug and supplements, they all do a lot of health communication. Even the fitness and beauty industry provide a lot of different health communication avenues. Finally, many individual health professionals communicate as part of their individual industry, such as a dermatologist providing skin and product reviews on social media. One of the first ways that industry communicates is through marketing and advertising. Remember that marketing is an umbrella term that includes many different strategies that serve to create a brand image, while advertising is one part of marketing. Here we have some screenshots of a familiar marketing campaign, the Got Milk campaign. This was designed to build the brand of milk as a food product and ultimately create and sustain consumers of milk. The overall campaign is the marketing aspect, while individual components are advertising, such as the print ads put into magazines with various celebrities showing off their milk mustache. Early advertising of health focused on products, but there were very few laws in place to protect consumers from deceptive marketing or even from dangerous products. These ads focused on print mainly, but traveling medical shows were also prominent. Many products used buzzwords like pure and safe, but of course this was a marketing technique. Here you have a couple ads from the early 1900s. One promoting Coca-Cola, which at the time actually contained cocaine, but notice the focus on pure water. It was being positioned as a product that is safer than drinking water, which may have been the case at the time. Fitness was also advertised early on. Here's an ad for a punching bag as a novel way to build health and strength. Then came the rise of regulation. The Pure Food and Drug Act of 1906 required labels for amounts of things like alcohol, morphine, opium, but it didn't prohibit distribution of dangerous products. In 1937, an improperly prepared antibiotic was linked to more than 100 people dying, which led to the founding of the modern FDA, which shifted thinking away from consumer self-medicating and began to require drugs that prove safety in order to receive FDA approval and be marketed. We also saw the beginning of branding and branding mascots. I've got a few here that you may not realize are so old. The Jolly Green Giant was introduced in 1928. This was a mascot to sell frozen and canned vegetables. Tony the Tiger was introduced in 1951. The Kool-Aid Man in 1954. In the pharmaceutical world, this time period reflects the change from marketing directly to consumers to marketing to the doctors that could prescribe the drug. By the 1960s, more than 90% of pharmaceutical marketing was aimed at doctors. In 1969, the FDA firmed up advertising regulations requiring drugs to provide a true statement relating to side effects and effectiveness. In the food world, we continued to see a shift to fast, easy, time-saving products. We also saw the introduction of fast food restaurants, and they began to thrive, and with that came advertising. I have a couple of advertisements here. One, the Taco Bell ad is from the 1970s, and the McDonald's ad is from the 1960s. It cannot be understated how influential food product development and marketing was on the way Americans cook and eat. Food products were being developed rapidly, but food companies needed to create a demand for their new products. Advertising of the products leaned heavily on tips, recipes, and ways to creatively use the new, time-saving, and modern food product. For example, did you know that the peanut butter and mayonnaise sandwich, maybe your grandparents used to eat this weird sandwich, maybe you do it as well. It was originally promoted because the food company, Best Foods, wanted to create a demand for two of their products. The food and self-care world at this time focused a lot on convenience. New food products were unveiled, and this really began the world of processed foods, marketed to busy housewives mainly. This form of marketing continues today, and it's not just found in the food sector. For example, Apple had a marketing campaign around the safety features of the Apple Watch. Up to this point, the watch was being purchased by people to track health data and have easy access to things like text messaging. But Apple did a campaign push highlighting how people had used the watch in an emergency situation, ultimately saving their life. The intent was to plant the seed that this watch has many uses, even for people who have no interest in the more popular uses like fitness tracking. On the bottom was a short-lived campaign by Taco Bell when the restaurant attempted to create a brand new meal category that they called fourth meal. They defined this as the meal between dinner and breakfast. It did not take off, but they tried. Back to 1923, here's an ad that was intent on teaching Americans how to use pasta. At the time, pasta was not familiar to Americans. The company decided to create a need for their product by educating people on how to use their product, explaining that they can use macaroni just like they use potatoes, which were very common on dinner plates at the time. Marketing and advertising of health products still happens, of course, but it has evolved with the times and regulations. Now we have a mainly online consumer who has access to many different platforms. Some platforms deliver content based on internal algorithms, meaning you're browsing content that's geared straight toward your own demonstrated interests. We're no longer a captive audience, so companies need to find a way to reach us. Some of this is done by stealth marketing practices. One example is the picture on the bottom of celebrity influencer Kim Kardashian. In 2015, Kardashian was paid to post a selfie with a medication, but she did not clearly disclose that she was being paid to do this. Also, the FTC determined that this is a pharmaceutical ad, even though it's her personal Instagram account, and it still needed to follow the law in providing potential side effects. This high-profile case led to the creation of guidelines and tighter regulations for influencers and paid sponsorship, which we'll touch on later this module. We are also in a global economy. We can purchase products that come from anywhere in the world, bringing a unique challenge to regulations. Also, we're dealing with the rise of social media influencer marketing. The combination of an online and rapidly evolving information landscape with this global economy makes it a bit of a cat and mouse game for US regulators to keep up with. One interesting place to browse is a section on the FDA website which publicly posts warning letters sent to various bad actors. In the side here on the top corner is an item claiming to change eye color with eye drops. The emergence of online shopping and the ability to bypass regulations means these snake oil products still exist, but they're marketed differently from the past. This company did receive a warning letter from the FDA in October of 2024 because it is a false product. It's not accurate and it might be unsafe. We'll see how it progresses. Direct-to-consumer, or DTC, prescription drug advertising began in the early 1980s, is only permitted in the United States and New Zealand. Studies have shown that these methods work. They've shown that there's an increase in demand from patients for prescriptions, and doctors seem to be complying with increased prescriptions, which is the entire point of the advertising. The American Medical Association has called for a ban on these ads. They stated that DTC advertising is driving up drug costs without additional benefits. However, courts have ruled in favor of free speech for the companies involved, as long as they play by the rules. Currently, they need to list some of the possible side effects, but they don't have to list them all, as long as they provide a number or a link to learn more. This table summarizes findings from a study on DTC marketing. You can see the number of campaigns increased during the study period, from 44 campaigns in 1997 up to 401 in 2016 when the study concluded. You can also see that the conditions focused on shifting from year to year, with chronic dry eye being the most common condition in 2016 compared to smoking cessation in 1997. Another arm of marketing is in the form of educating. On the left is an example of consumer education distributed by the Distilled Spirits Council, which is an industry advocacy group working on behalf of the alcohol industry. Much like the tobacco industry, the alcohol industry participates in education efforts to help with their bottom line, which is to continue to sell alcohol, but to still seem like they are part of a solution. These efforts frequently focus on drinking in moderation. Here's a screenshot for a tool they provide called standarddrinks.org, which contains information on drinking in moderation along with an interactive calculator. The other screenshot is an article about breastfeeding. However, this article is provided by a company that makes infant formula. Now pause for a moment and consider why an infant formula company would provide information on breastfeeding, which is their direct competition. The answer is so that they can be top of mind for when a parent decides there's a need to supplement or transition to formula. They're positioning themselves as participating in the solution. However, this information is likely going to be biased, but in a very subtle way. When you use a critical eye to examine breastfeeding advice provided by formula companies, you'll find certain techniques that are used to make breastfeeding seem a little more difficult, or a little more time-consuming, or just not for everyone. It won't be in your face. They won't get away with that. However, this article on breastfeeding secrets puts a larger emphasis on things like the potential for sore nipples and also dealing with leaking breast milk. This is on purpose to hopefully nudge potential customers away from the competing product. Many people are not aware that many commodities have their own advocacy board. These are called research and promotion boards because their focus is putting funding and effort into research on that commodity to ultimately identify benefits that can be promoted. And then they also focus on the marketing of that product. Here's two examples. A healthy beef cookbook that was created by an industry board representing cattle ranchers. This cookbook is beautiful if you were able to see it in person. It's glossy, it has beautiful pictures, the recipes are well developed and tasty. An individual cattle rancher wouldn't be able to put out this kind of education piece, but when they participate in the commodity board and pool their money together, they are able to do these education outreach tools. And then we have a promotion on Avocado Toast Revolution. And of course, this one is promoted by the Avocado Board. These programs are also called checkoff boards. Checkoff programs were originally voluntary. They got their name because farmers had to literally check off a box to pay into the shared promotional and research fund. Eventually, Congress provided the authority for boards to require mandatory fees from producers. Of course, various industries spend money on lobbying activities in order to influence policy and protect that particular industry. Here are the various industries in the health world and how much they spent in 2024. This is from a website called opensecrets.org, where you can go and explore which industries are spending what, who's the big spenders, and how it changes from year to year. Industry is also heavily involved in funding or sponsorship type activities for health professionals. They partner with health professionals in a number of ways. I put purchases in quotation marks with a question mark because this really is the nagging issue. When a health professional accepts money from something like Abbott Labs, have they been purchased? Well, we're not going to dive into that in this class, but I do want you to be aware that there is the potential for that perception. So for example, I have up on the top corner a picture of people with Coca-Cola bags. This picture was actually snapped at a dietetic conference, and so Coca-Cola had provided free swag, and the conference providers were happy to give it out to the attendees. However, people did not like this. They did think that this was a bit of a conflict of interest for dietitians to be partnering with something that is really not the healthiest product. And so we do need to pause and reflect on, do we really need that money, or is it tainting our reputation as health professionals? This is not an easy answer. So this is definitely something that you will be facing in whatever field you happen to go to in health, because every aspect of health has to grapple with their decisions on whether to take money and partner with industry or not. So this is an ad from an industry magazine aimed at pharmaceutical industry, and it's an advertisement to put your name on a pen so that you can give it out to health professionals. This works. Imagine if you go to the doctor and say you are about to have a baby and you're trying to figure out if you're going to breastfeed or formula feed. And the doctor is writing your notes or writing with a pen that has a formula company on that pen. This sends a clear message to you as the patient that this is a brand that is endorsed by your doctor. The doctor doesn't even have to say anything. The endorsement is implied. And if you decide to formula feed your baby, you're going to have to choose which brand of formula to choose. You'll probably go for the one that your doctor was using a pen from. And so it definitely works, and it happens in a number of different ways.